I do see a lot of patients as well for problems related to hip and knee replacements that have been placed previously, whether that was done a year ago, 2 years ago, or 15 years ago, and trying to understand why they're not working as well as we want them to. There can be a variety of reasons that joint replacements aren't behaving themselves, or people are continuing to have pain after the fact. And my job, which can sometimes be diagnostically challenging, is to determine what the origin of that is. Sometimes it's straightforward, and it's something like an infection or the implants are loose. However, sometimes it can be very subtle things and can be related to how the implants are placed or any residual subtle instability that's present in the joint replacement. Obviously it's an involved process of trying to determine what the origin of that discomfort is. And if we do find that we can fix those problems with revision surgery, we do discuss that. However, we don't bring that up lightly. Obviously, we want to seek a solution that is not surgical, but sometimes we have to do that.